Hello everyone, my name is Byron Chingome. I work for an NGO based in Zimbabwe called PSI, and we take care of key populations focusing on members of the LGBTI community in Harare and also on female sex workers. So I'm going to share with you a story today of how our care for the LGBTI community changed because of our interaction with COC and its partners. So before we had interacted with the CBOs and COC called GALS, CBO called GALS, the LGBTI did not have access to healthcare in Zimbabwe, Harare in particular. So LGBTI community is still stigmatized and criminalized in Zimbabwe. So they feared accessing health from both private and public health institutions. They would come for treatment late, and sometimes the healthcare workers would not comprehend what they are talking about, and they were not tolerant. A team called Gays and Lesbians of Zimbabwe, which has a lot of collaborations with COC, came to our clinic after invitation. They sensitized members from all departments at our clinic. Sensitization meeting from GALS was held around mid-February in 2016. We mobilized members from healthcare workers from all our departments at the clinic. It was a 3-hour packed workshop where we had a pre and post test, and we received very good feedback from the staff members. Their perception of the LGBTI changed a lot. We then took the members from the CBO called GALS around the clinic. We showed them the services that we offer, and we brainstormed on the possible collaborations on how we can best make access of healthcare to the LGBTI community. So after the meeting, we also then went to their offices to strengthen the collaboration and also get an understanding of how they function. So what then touched me and impressed me was how things changed soon after this sensitization meeting. The first thing that was notable was the increased number of members of the LGBTI community, both MSM, lesbians and bisexual. They were now coming to our clinic. We were seeing less than 3-4 patients per month from the community, but soon after this sensitization meeting, we're now seeing numbers as large as 40-50, sometimes even up to 100. They do come to our clinic for various services, and those who require ART as an HIV positive, we incorporate them into our HIV program. And we're getting positive feedback. We do exit surveys with members of the LGBTI community so that we can improve our systems, and we're getting quite positive responses. And they come also with their friends. They are giving us the feedback that they do refer their friends and colleagues, and also intensified mobilization for whatever activities that they do in their communities. They are also appreciating to an extent the one-stop shop concept, with which we try to give them as many services as possible when they do come to our clinics. And when they leave the clinic, we give them as much as we can, and if we can't give them, we have exit points. We know where to refer them, and that has been working quite well. Another important aspect of our clinic, which I see as a positive story to tell, is the feedback mechanism. We have referral systems which go either way, either they refer from GALS to us and the confirmation back to GALS. That makes sure that no one is lost along the way, and we get feedback to each other. So, and we are also in continuous communication with this CBO called GALS, such that there's constant improvement and constant feedback and increased collaboration, so that we keep giving expert care to members of the LGBTI community. Going forward, I think this is bound to improve, and we are bound to give better care going forward to these once discriminated members of the community. So I thank COC again for allowing us this opportunity and allowing me this presentation, so that we increase awareness and keep improving the care of members of our community.